additional funds where necessary if they came back to us and said that they needed some to try and implement that.
All right, so that's just as good. In other words, it gives us a plan and outline what we have to do to ensure that our streets are safer for our citizens.
Correct, Counselor.
Thank you.
Thank you. Council Belanger? And then we're going to open it up to the public, because again, as Council Mercy said, we want you to be recognized and thanked for your hard work. Council Belanger.
Thank you, Mr. Chairman. I do want to, through you, Mr. Chairman, thank the representatives here today. This is a great education we're getting here this evening. It's certainly a great program, one I'm certainly in support of. Anything we can do to alleviate traffic congestion by alternative methods of transportation, I'm all in favor of, especially if we can get grant money to achieve that. So I'm in support of it. I think as the NEMCOG representative on the council, I will keep the council updated on this. I think it's great, so let's expedite this as much as we can, because we have representatives from the state here today, so we're already ahead. Let's stay ahead. Get the jump on the other community, so to speak, and let's expedite this as best we can. Thank you very much.
Thank you, Council Belanger. At this point, I'd be happy to open it up to members of the Pedestrian Safety Committee, I believe you called it, Mr. Coughlin. For those of you that want to come to the podium and just address the subcommittee relative to the Complete Streets program. Okay, thank you. If you wouldn't mind, there's a sheet of paper at the podium. If you could just sign the sheet of paper, and then identify name and address, please. Thank you.
Hello, my name is Andrea Freeman. I'm the field director for the Massachusetts Public Health Association. We're based in Boston at 14 Beacon Street, although I'm a resident of the city of Leominster and a huge fan of the city of Lowell. And I'm here to offer support for, and to encourage you to recommend to the City Council the Complete Streets policy. As I mentioned earlier, and I'll provide this list of the communities, the municipalities across the state that have either adopted a Complete Streets policy already, and that includes communities such as Somerville, Stoughton, Salem, Plymouth, small, but not Worcester, not Springfield. You would definitely be the largest, and you would actually beat Boston to the punch of an official policy. Having complete streets is a way of saying that you care about more people having more options to get to the places they need to go, whether that's school, whether that's work, whether that's family, whether that's recreation. Supporting complete streets is a design method, and the state and the federal government already require complete street design implementations on all of their road projects, and this is complete streets funding through the Mass Department of Transportation. This is incentive funding to try to get the municipally controlled roads to be implementing very similar guidelines as well. And as the $12.5 million that's in the capital budget, that's actually coming from gambling licensing fees. So that's actually money that's not even out of the bond money that was passed in the transportation bond bill in 2013. So I'm happy to answer any questions, but I would think you guys get it.
Right. Thank you so much for being here and for your hard work. Thank you.
Just my name? Or?
Yes. Yeah, that's fine. Thank you. Anyone else like to address the subcommittee?
Address, you said?
Yeah, nope. Thanks. Thank you. Welcome.
Hi. I didn't know how much time I have, so I wrote down a little thing, so I'm just read it from it.
Sure.
So my name is Sidney Liang. I live at 23 Phillips Street in the Acre neighborhood. I work for Lowell Community Health Center with a program called Lowell in Motion and Mass in Motion that's funded by DPH and the Greater Lowell Health Alliance, a state and local movement that promote opportunity for healthy eating and active living. I'm here to speak in support of the drafted Complete Street policy because transportation opportunity or lack thereof impact physical activity, it impact air quality, traffic injury and death, it impacts social cohesion, and perhaps more important than anything, it's impact access to opportunity, our ability to get jobs, to healthcare, grocery stores, to families, to parks, and to other places that are absolutely essential to our health. I am strongly encourage this subcommittee to recommend to the city council to pass this complete street policy. Thank you.
Thank you. Thank you. Please sign in. Thank you. Anybody else wishing to? Good evening. Thank you for being here.
Hi, I'm Danielle Maccheroni. I'm the Energy and Environmental Planner at the Northern Middlesex Council of Governments. One of our transportation planners, Dave Tilton, was part of the committee, and he was not able to make it tonight, but NIMCOG is supportive of the policy, and most of the reasons are the same that Sydney just mentioned. Promoting health, safety, and the environmental benefits as well as multimodal transport. And I also just wanted to say a comment on behalf of a couple of the youth groups who we worked with recently. We had a project we called Healthy Transportation Barriers Project, and we worked with Girls Inc. and Boy Scout Troop in Lowell to walk around the city and document with photos transportation barriers that they came across. And so they went out with cameras, they took pictures, and then they summarized their results for us. And some of the main barriers that they faced as youth were disconnected trails or sidewalks, so trying to go out and ride your bike somewhere and not being able to get off the trail or things of that nature. Also infrastructure maintenance issues such as faded crosswalks or crumbling sidewalks or vegetation on the sidewalk. So most of their barriers had to do with biking or walking. And so both of the youth groups involved with the project at Girls Inc. and at the Boy Scouts also support the complete streets policy so they can get around the city safely.
Great. Thank you. At Councilor Belange's request, I actually reached out today to NIMCOG, and I believe we're going to have a presentation to the Transportation Subcommittee sometime in the next 6 weeks or so on that very project, so thank you.
Hi, I'm Dr. Mindy Doppler-Nelson. I'm an obesity researcher, a resident of Lowell, and one of the founding members of the Lowell Bicycle Coalition. So just to give you a sense, by having more people take alternative methods of transportation, whether it's public transportation, walking, or bicycling, for example, what you're going to do is improve the health of the residents. That will end up being a cost savings in medical expenses to the citizens. It'll improve the air quality, which as a result will also decrease risk for asthma. People who walk or bike more will lower risks for hypertension, manage existing or prevent diabetes, and also reduce the risk for obesity, once again, lowering overall health care costs. It also would put Lowell on the map as being a city where we're initiating more green measures. And I think that because this is where the Industrial Revolution started and we've been renovating the mills, that would just be one more thing to put us on the map. And it would be great to get people out of the cars for commutes that are less than 2 miles. If you see people running to Market Basket and Hannaford's and Stop and Shop, for example, a lot of these trips are less than 2 miles, and it would be wonderful for people to have alternative methods to get there. Thank you.
Great. Thank you. Thank you for being here. Anyone else like to speak on the issue? Again, we will be having a public hearing. The task for the subcommittee now would be, unless there are other comments to be made, would be to recommend to the full council that this be referred to a public hearing at our next, I believe we can do it, Mr. Clerk, for our next meeting, because it will have to be advertised, so we could do it for our meeting in August, the 11th of August 11th, right?
Yeah, that'd be fine.
Okay. Thank you. So the chair would entertain that motion.
So I make the motion to refer it to public hearing.
Well, again, it goes back to the city council to be referred to the public hearing. Is there a second?
Yes, second.
All those in favor indicate by saying aye.
Aye.
Opposed? It's a vote. Thank you. Anything else to come before? Yes, Councilor Mercia.
And maybe at that time, we could introduce the public to all the
Yes,
people that took
absolutely.
time. Maybe not tonight,
Right.
because there's a lot that are probably not here.
Correct.
But people should be recognized for all the work
Yeah,
that they
that's a very
put in
good
to
point.
make this city safe. That's
Correct.
important.
Right.
So
Very
thank you.
good point.
Mr.
Thank
Chairman.
you. Thank you. Any other business on this matter to come before the subcommittee? Hearing none, I'll entertain a motion to adjourn. Second. We stand adjourned. Thank you.